Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay.
When you want holiday comfort you can count on, it matters where you stay. Enjoy comfortable rooms and friendly service when you stay with Hilton instead. Save up to 25% this season when you book with Hilton. Hilton for the stay. Terms apply.
With new, gentler scented Clorox disinfecting wipes, clean finally smells as good as it feels. On everything from lamps to ceiling fans. Even on your kid's toy shark. Oh, ouch. Clorox disinfecting wipes. Now available in crisp lemon. Find it on Amazon. Clorox. Clean feels good.
Hey guys, and welcome to another episode of the Financial Freedom Podcast. I'm really delighted about today's guest, Dr. Amy Loden Tiffany. She goes by Amy, and she is here to talk to the audience about humanizing healthcare and restoring trust in the age of AI, social media, and Google. And I'm really happy to have her on. She's a physician, entrepreneur, spoke on TEDx stages, author, and I'm really happy to have her on. So Amy, welcome.
Thank you. I'm happy to be here. Excited to share with your audience and to connect.
Yeah. Briefly introduce yourself, and there's so many questions I have for you to share with the audience.
Sure. So I'm a medical doctor by background. I'm in St. Louis, Missouri. I specialize in internal medicine, and within that context, really midlife women's health as well as postpartum. And really what I'm invested in is how do we take the opportunity these women have to change their health stories so that in their 60s and 70s, they're not dying of heart attacks and strokes. And it's a really fulfilling place to be, but I wouldn't have done that if I didn't open my own business. And so my story in this world really started 5 years ago when I was brave enough to leave the traditional and do my own thing. So that's where I'm at.
Yeah, and that's a great start to the conversation. And the first question I have for you is, how did you go from being MD to talk about humanizing healthcare and talk about restoring trust in this age of AI, social media, and Google?
Yeah, it's funny to me, ever since residency, people would come in and almost sheepishly say, oh, I looked on Google. This is what I have. And I'm young enough in my practice, I should say, that it didn't really bother me. But people 10 years older than me were like, why do they look on Google? Like, they shouldn't do that. And so for me, I was like, but they did, and they're going to. So let's work with it instead of against it. And now more recently, about the last 18 months, it's a lot more of not Dr. Google, but Dr. ChatGPT. And so then people go through the same spirals, like ChatGPT says, I have leukemia. I'm like, okay, big breath. Let's see where we really are, right? And I use AI in my healthcare clinic, and I think it's a good tool, but it can be like any tool and misused, abused, and even cause harm. And so one of the things I have observed in my practice over the last 5 to 7 years, there's no doubt that there's a little bit of distrust that was already present before COVID, but COVID markedly amplified that. And even people like myself who thought we were saying the right things and now have to look back and say, gee, that wasn't the right thing. And that's a really uncomfortable part of practicing medicine and being a scientist, is sometimes mistakes are made. And it doesn't mean everything was bad, but it certainly, I think, calls for humility and for saying we didn't get it all right. And so AI and Google make mistakes, so do humans, right? And when we look at that and try to say, who can we trust to lead healthcare? I think it strongly needs to be the humans. And we use the AI tools, but in a way that magnifies someone's health potential.
Another great segue to guess, he was a urologist, and he did the same thing. Corporate medicine could not provide what he wanted to do for his patients, and he helps men achieve better, longer fulfilling lives, and you help women. What is the common problem that you help with women patients that come to you? What are obviously they're burnout, but What does middle age, what does postpartum have to do with all of it?
Great question. So one of the common themes I see, and I'm not a gynecologist, which gives it an interesting twist, right? But what I see is after a woman's had a baby or when she's going through those perimenopausal years and midlife years, her productivity has changed, her ability to concentrate changes. She loses confidence in herself in a way that wasn't present before. It's almost like she can't trust her body. And of course, this doesn't happen to the same degree for everyone, but everyone will acknowledge they're different from before they had their baby or before the menopause happened. And really seeing what's happening and how it shows up in each person's life. But confidence is a big change that these women go through, and they start to self-sabotage. They start to think even more that they have imposter syndrome, whether they had it before or not, but they start to just really spiral. People who aren't anxious can start overthinking. And then, of course, you have people who struggle with anxiety or depression, and that makes it even worse. But there's this overthinking pattern. And so then what's logical? If I keep thinking about this, let me Google it or let me ChatGPT. And what's unfortunate is this is combined with an element that for decades, we haven't studied women's health in a way that we've studied general health or men's health. And of course, I think any physician would acknowledge that women are not littler men, right? And men are not bigger women. There are differences. And so how do we look at the unique aspects for each, and how do we honor and respect those? And where I think where trust has been lost is in so many people finally realizing that in medicine, we've done a really bad job of acknowledging the differences in our studies. And some of these were for legitimate reasons. We didn't want to have reproductive women go through studies that would harm a future child, right? Some medicines live in the bones for years. And so we didn't want those negative things. So something that was done to be a good in some aspects backfires on us. So, and there's a big gap. And that's partly what I talked about in my TED Talk is there's a lot of gap between OB care and long-term primary care for women. We don't have the data. And so many times these women will tell you they just feel like they were blown off, that they're experiencing this idea of this is in your head. It's not a medical problem. The tests are normal. Therefore, you're making it up. And that does nothing to validate trust. It destroys it. And so that's the big thing I really work on with women is seeing where they at on that spectrum. And I've been a patient enough times to realize that even me as a physician navigating the healthcare system as a patient, there's a lot of room for improvement. It is very imperfect. And the truth is, even if AI ran it, it wouldn't be perfect, right? Because you're still dealing with humans. Hopefully that's a good overview.
Yeah. Yeah. And for the audience, Amy wrote the Postpartum Pivot, which the links will be in the show notes, and also the TEDx talk will include the links. So a lot of your story we can take to the audience is talking about facing your fears and our definition of success. How, a lot of people, they're listening to this, they're like, oh, you had a picture perfect career and you had it all. And why did you do that? Why did you pivot? What were the reasons?
Great question. I left academic medicine partly because I saw coming down the road that telemedicine was going to be a big deal. And I wanted to be involved with that. And I just wasn't going to fit with where I was at the time, with my employer at the time. And I wanted to work more with women's health. So I left, I joined an OBGYN practice, started telemedicine, and a year and a half later, the world shut down. So it was like, wow, now they have to do telemedicine. I wish they had just done this already, right?
Yeah.
But my practice is probably 80% telemedicine now within the people we serve, because many of the things that we're talking about don't actually need me to lay hands on you and examine you for them. If I'm a surgeon, that's totally different. But for the thought professions, it lets it be a little easier. The problem I ran into, the pain point that I couldn't get around, though, is I still had about 3,000 patients. And that's pretty common for most primary care doctors, is 2,500 to 3,000. And I didn't know patients well. How can you when you have 10 to 15-minute visits and you have that many people? I was working full time. So for reference to your listeners, that means I was doing 40 to 50 hours in the clinic. And then I was doing another 25 to 45 hours outside of my clinic time, just trying to keep up with writing all the notes and putting in all the prescriptions and responding to all the messages. That's not a healthy lifestyle. Just do that math, okay? That's not a healthy lifestyle for a single person. And at the time, I had 4 children. We have 5 now.
Wow.
I had 18-month-old twins and a 5 and a 7-year-old. And I was up one night late doing charts, and my 7-year-old daughter came in and she was like, "Are you buying my birthday gifts? My birthday's coming up," super excited. And I like snapped at her. I was like, "No, I'm doing charts. It's time for me to go to bed." Right? Didn't even think about it. It was so awful. And she didn't move. And I looked up and she's just got her beautiful blue eyes are just filled with tears. And she's just silently looking at me and her tears are coming down her face. And she says, "Mommy, why do you love your job more than me?"
Wow.
Yeah, exactly. Tried to do some damage control that night, but I told my husband, I was like, "Listen, this isn't working. I can either retire or I can do something different." And he looked at me, he's like, "Do not retire." "I can't deal with you being at home. Don't retire." So it's like, okay, then we will do something different. And 4 months later, I opened up Vitality Medical.
I think your story was there are a lot of common threads. A lot of my physician colleagues, their kids despise them because they didn't have that quality time. The other common theme with physicians is the medical definition of success. Like you're supposed to sacrifice yourself for your profession. And how does that definition of success in the past compare to your definition of success now?
Yeah. So for me, before I trained at Cornell in New York City, I wanted to be at the most elite places. I wanted to be faculty at an elite institution, and I was, but I wasn't fulfilled. I realized there could be so much more, and I wasn't making the impact I wanted to make because I was working in a very bureaucratic system. And it has its place, right? But I realized I was not a good fit for it. And so tried doing just corporate medicine with a multi-specialty group. Same thing though, it was insurance-driven model. It was produce more, produce faster. And for me, success is knowing my patients. It's being able to walk in the exam room, and when they tell me they're doing fine, I can look at them and say, "Are you really?" Because that is not your fine. And being able to know what's going on, to agree with them, to celebrate with them, and to know who they are as a person, what the goals they have are. So that version of success did not fit into the prior models. And what I do now, we run a membership, Concierge's clinic, and I spend 30 to 60 minutes with each appointment at every appointment, each patient at every appointment. That's just totally different. I don't have 3,000 patients anymore. I get to come on shows and share with other people and encourage people like this. I was able to write the book and do the TED. I couldn't have done any of that. And to me, my definition of success is impacting as many people as I can. And a one-on-one model, which was 3,000 patients, you impact 3,000 patients. That was not acceptable to me. And I just think that God gives us dreams and visions, and to not go after them is actually selfish. And I think it's very selfish to society and humanity in general to not give your best. So whatever calling it is, leading into that. And it's really hard to do that when you're burned out. It's hard to do it without support. It's hard to do it when you don't know how your next paycheck comes. So everyone has their thing, and acknowledging what those obstacles are and then figuring out how to get them addressed.
What advice would you have to other women who feel called to something bigger, their fears? How did you reconcile your fears? And for example, your colleagues that say, "Oh, you're leaving academic medicine," or you're leaving corporate medicine, "Oh, you're doing something different." How do you address these people that question what you're doing?
Yeah, I try to come at it with a lot of humility, because I was one of them too. And I was the person that was like, every primary care doctor we lose, that's that many more people who don't have access to care. And I think it depends partly on what do we call access? Is it just being able to see somebody who can write a prescription? Or is it being able to have the time to educate someone on how they can change a habit and have a totally different outcome for their life? To the other women who are physicians who would be considering this, number one, I would say you have a lot more control than you realize. The results you're getting are from every decision you've made up until this point in your life. That's true for all of us. And if you want different results, you have to do different things. So maybe it looks less scary to join a practice than to start your own. A real common red herring, that people put up is, "I don't have any business training." And I beg to differ. Doctors are like the best people at business thinking, because we're trained to think critically, analytically, and to separate and to see systems and to integrate and move them around. That's just the way we are. So I am a big fan of doctors leaning into the skill set they've learned. They don't have to go to business school. Like I chose to because I like business, but you don't have to go to business school to run a business, and you don't have to go to business school to make an impact. And I would encourage them to go back to, why'd you go into medicine? Why did you want to be a healer? There was some impact you wanted to make, and dig into that impact and figure out if you're making it. And if you are, great. If you're not, there's always a better way. And maybe that better way hasn't been created yet because you were supposed to create it.
Another thing that a lot of physician entrepreneurs do is once they branch out and they're doing something novel and innovative, sometimes they have to decide who their peer group is. I had to do that myself. I had to shut out just my old colleagues because they were
Yes.
just constantly badgering me. So how do you personally decide what gets your yes and what gets your no? And how do you deal with this fear of guilt and shame that you left a very solid, stable position?
Let me address that part first. I think it's really important to ask, is that your burden to carry? Do I need to have the shame that someone else wants to give me or the burden? And if my desire was to impact as many people as possible, and I knew that was more than 3,000, then there's no way I could stay what I was doing and just cap out. So I have impacted many more thousands by doing this. And I feel like that's a better contribution of my unique skills. To the first part of your question, I have what I created the VIP filter. It's what I work with in our clinic with our patients. And very briefly, it says, what are your values? V is for values. And I have them work with, you probably are familiar with Brene Brown's work or James Clear, the Habits book that he wrote. And we figure out what your values are, what's important to you and why. So for me, I happen to have gone through this a few years ahead of some of your listeners, perhaps. And for me, what I've discovered is that my values are going to be my faith, my family, and my fitness in that order. And so if something comes along as an opportunity, and we all get them, right? I got an invitation last week to be the medical director of something, and it sounded really cool. And I was like, ooh, for a second, I'm all excited. And then I was like, wait a second, that doesn't align with my values. Like, it's cool, but it's not for me. And so I need to let it pass. I is for impact. I want to have a certain impact. What does that impact look like? What does the success in reaching that impact look like? And of course, the truth is, once you reach a certain goal, then you tend to make a new goal. But at the end of the day, understanding what is the impact I want to have and who am I trying to impact? For me, my biggest impact that I want to have is not my patients, it's my children. And so if I'm impacting them, great. The business exists to serve my family. My family does not exist to serve my business. And so for me, the impact, having it really clear, who do I want to impact and what does that look like, defining it. And then finally, the P is for prioritization. I find across the board, across specialties within medicine and across professions, so your attorneys, your engineers, your other high achievers, we all have this idea that we need to be better at time management. We need to get more done with less, right? And frankly, that's nonsense. These people do not have a problem with time management. You do not have a problem with time management. Your problem is priority management. And when you figure out how to get your priorities straight, it's so much easier to say no. And you don't even have to feel guilty about it because you're aligned. You're living in alignment with your own self and what your life is. And that is just a beautiful way for me to quickly think through things of, does this align with what I'm doing? Will this impact my family negatively? And where am I needing to prioritize differently? This is in full focus for me because we recently took on, in August of this year, we took on a foster baby. If I hadn't been in the role I'm doing now, I wouldn't have created the space in my life to be able to give back to this foster child. And that's just one example of saying no to so many good things in order to say yes to something that's really great.
What practices or rhythms help you stay in a state of overflow in your life?
Yeah. And not having overflow, I think, is what you're getting at, because I think otherwise I'd be totally overflowed. But for me, I really work hard to get up and do some Bible reading and devotion and thoughtfulness and prayer for our patients that are coming in. I also try to walk regularly. Of course, that new study that says I have to be intensifying my activity did not make me happy this week. I'm like, okay, we're going to stick with walking until January. I try to have regular check-ins with my husband. You can imagine with 5 kids, it's a lot of movement and activity and certainly noise. So just planning, when are we going to have a check-in each day or each week, and what does those look like, and then honoring that time and space. So those are some of the basic rhythms that I really try to do, aside from brushing my teeth and showers. Those are luxuries, right? When you got a little kid home.
Yeah. Lastly, how can people connect with you, check out your book, your TEDx talk, and if they wanted to actually see what you do, how can they do that?
So easily go to our website, vitalitymwc.org. We are located right in the middle of St. Louis, and we help people wherever they're at. I guess I can't say internationally, but within the States. In terms of the book, they can either download it on their Kindle, they can buy a paperback, they can get a free copy from us. If they just reach out to our office, we will ship them a free copy. And they can follow me on social at Dr. Amy Tiffany.
Excellent. I really enjoyed talking with you, and the audience really appreciated this inspirational message, and keep up the great work.
Thank you. Appreciate you having me.
Hey, Ryan Reynolds here. Wishing you a very happy half-off holiday because right now Mint Mobile is offering you the gift of 50% off unlimited. To be clear, that's half price, not half the service. And Mint is still premium unlimited wireless for a great price. So that means a half day, yeah?
Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speeds slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.